The lights are flashing. Okay, come on in, Mr. Alexander. Have a seat. I'm going to provide privacy. I'm going to wash my hands. Hi there, Mr. Alexander. My name is Suzanne. I'm going to be your nurse today.
Okay.
Can you just tell me your name and birth date?
Yeah, Brian Alexander, 10/29/1968.
All right, great. And can you tell me where you are today?
At the clinic.
You're at the clinic. So we have A&O times 3, alert and oriented. Obviously, he walked in here. He has a nice steady gait. Nothing that we need to be worried about there. Can you tell me a little bit about yourself? Have you been in the hospital before?
Yeah.
What were you in there for?
For knee surgeries.
How many knee surgeries did you have?
2.
2 of those, and when were they?
Last August and December.
Okay, great. And how are those knees doing now?
Great.
Any pain?
Nope.
Good, good. Any other surgeries?
I don't think so.
Okay. Any other medical history? Diabetic, asthma, high blood pressure?
No.
I think our light bulb's going out. Okay, so I'm just going to go ahead and do a focused exam on you today, or head-to-toe exam.
Okay.
I'm just going to be asking you questions. I'm going to be touching your face, touching your body, listening to your heart and lungs, listening to your belly, just checking over everything, making sure everything is all good. Do you have any questions for me?
No.
Okay, so I've washed my hands. I'm going to start off by taking your vital signs.
Okay.
So blood pressure is 120/80, heart rate is 70, normal sinus, I don't hear any. There's no extra beats in there that I could feel. Respiratory rate is 12, and temperature was a good 98.6. And so I document all your vital signs. How much do you weigh, sir?
250.
250. Okay, great. And how tall are you?
5'10".
5'10". All right. So I've documented all that in my chart, and so I'm going to go ahead now and start my focus assessment on him. Not focus, my head-to-toe assessment. So I'm going to just start by looking at your head. Okay. We're just going to look at your scalp. Great. Everything looks great. Go ahead and look up. And face is symmetrical. I'm looking at his ears, and his ears are lined up with his eyes. Everything looks good. Mr. Alexander, I see that you wear glasses. Are those for seeing things far away, up close?
Both.
For both. Okay. All right. Do you mind taking those off for me for just a second? Okay. Do you have any problems with your eyes at all other than wearing glasses?
No.
No? Okay. I'm just going to take a look at your eyes. So I'm just inspecting right now. I'm just going to look up for me. Great. Sclera conjunctiva is nice and clear, moist, no yellowing. And then I'm just going to take this light, sir, and I'm just going to shine it in your eyes. Great. And then watch the tip of my pen without moving your head. Great. All right. Now I want you to look at the tip of my pen. I want to let you look out the window and back and out and back. Great. Perfect. Okay. So we have Perla. So pupils are equal and reactive and round, and they're accommodating and they're reactive to light. Okay. Great. I'm going to look at his ears. Okay. Ears are good. Can you hear that?
Yep.
All right. That ear looks nice. You hear that?
Yep.
Okay, great. Any issues with your hearing?
No.
No? Okay. All right. Next, I'm just going to move on to his nose. Nose looks nice and straight. And I'm just going to look inside with my handy dandy pen light. Just going to look inside your nose. Everything looks clear there. I'm going to look inside your ears as long as I have my pen light out. Everything looks nice and clear there. All right. Now, can you look up at me? Okay, lips are symmetrical. Can you smile for me? Good. Just checking your cranial nerves. Can you open your mouth for me? Great. Just looking around. Lips are moist. Palate's nice and moist. Everything's moist. Can you open your mouth a little bit more, please? Can you say ah? Great. I'm going to check your gag reflex. There we go. All right. Thank you, sir. So everything looks good inside the mouth. It's nice and moist, pink. Lips are not dry or cracked or anything. Just going to check your neck here, sir. Looks good. All right, I'm going to feel your carotid pulse on this side. I'm going to feel it on this side. Great. We'll check for JVD in just a moment. Okay? 1 second. Just wanted to make sure I hit the record button. Okay, so I'm checking for this. All right, can you push against my hand, please? All right, push against my hand. Turn your head side to side. Look up. Look down. Great. Okay. Can I have you lay down on the bed here for just a moment? You can put those back on. That's great. All right. So at this point, I would have the head up at 45-degree angle, and I would be checking for JVD, which I do not see any at this time. All right. Sir, you can go ahead and sit back up. All right. Do you have any issues with your heart?
No.
Have you ever been told you have any sort of heart condition?
No.
Do you have a family history of cardiac disease?
Yes.
Yes, what is that?
My father.
Okay, and does he have high blood pressure?
Yes.
Does he have heart disease?
Yes.
Okay. All right. How about your lungs? Any issues with your lungs, shortness of breath, anything like that?
No.
Okay. All right. So normally I would do this without a shirt on, but I'm going to inspect his back, sitting up straight, and I'm just going to kind of palpate the spine. You let me know if you have any pain at any time, okay?
Sure.
Any pain at all?
Nope.
All right. Everything feels nice there. Checking the scapulas. Everything's good there. Okay. Just going to look at your arms real quick. Can you hold your hands out like that? And then out to your side, up in the air. Great. Okay. Any problems with your shoulders at all?
No.
Okay. I'm going to check pulses in your arm. Your wrist. Okay. Check your cap refill. Okay. Skin is dry, warm. Check your pulse. I'm going to check your pulse down here. And I'm going to check your cap refill. And it is less than 3 seconds. All right, so he has good range of motion in his arms, good cap refill, good pulses. Extremities look good. I don't see any bruising, any sores, any open wounds or anything like that. Skin is dry and intact. Okay, so then I'm going to move to your chest.
Okay.
And I'm not going to have you take your shirt off. Normally I'd have him take his shirt off. But I'm inspecting your chest. I don't see any, again, skin is nice and dry and intact. No sores, no wounds, nothing like that. We've already talked about your cardiac history. And do you have a family history of any lung disease? Asthma, COPD?
My mom has asthma.
Your mom has asthma? Okay. All right. But you don't have asthma?
No.
Okay. All right. I'm just going to take a listen to your lungs, okay?
Sure.
All right. Again, I would normally do this with a shirt off. So take a deep breath through your mouth. And again. And again. 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 A real deep breath, please. And again. Great. One more time. Listen to the lateral side over here. Go for it. Great. Then I'm just going to listen to heart sounds. I'm going to listen to the aorta, aortic valve, pulmonic, tricuspid, mitral, and out to the apex. Same time, I'm going to listen to lung sounds on the front. Deep breath for me through your mouth. Deep breath through your mouth. Again. One last time. Great. Okay, I'm going to just have you lay back for me. Okay, now I'm going to do an abdominal assessment. So I'm just looking at the skin of the abdomen, making sure that skin is intact. I see no scars from any previous surgeries. Have you ever had any abdominal surgeries, Mr. Alexander?
No.
Okay. How about any, how are your bowel movements?
Good.
Are you pretty regular?
Yeah.
Okay. When was your last bowel movement?
This morning.
Okay. And how about when you go pee? Do you have normal urination, no burning?
Yeah.
No burning or anything like that?
Nope.
Do you have a steady stream?
Yes.
So, okay. Nice. Okay. Do you have any rashes or any open sores in and around your penis or your perineum area?
No.
No. Okay. Great. Okay. I am just going to take a listen to your bowel sounds real quick.
Okay.
Again, I'm just going to do this through his shirt. And I'm going to listen to all 4 quadrants. We listen first before we palpate or percuss. Normally I listen for 1 minute in each quadrant. Okay, he has nice, normal, active bowel sounds. Okay, sir, I'm just going to feel your abdomen. If at any time you feel any pain, please let me know.
Sure.
Okay? Any pain? All right, I feel no masses. And then I'm just going to percuss. Okay, everything is normal there. Feel for liver and spleen. Okay. All right, can I have you sit up again, sir? Normally while a patient is laying down, I would then check the femoral pulses, but we're just not going to do that today. Okay, so I'm just going to tap on your back here. Let me know if you have any pain. Any pain there?
No.
All right. Excuse me, dogs. Any pain on this side?
Nope.
Okay, so no CVA tenderness. Okay, we have a dog in the way. All right. Now I'm just going to look at his lower extremities. So just looking at your legs, I see your scars there. How are your knees doing?
Good.
Good? Okay. No pain or tenderness in those knees?
Nope.
Okay, great. There's not even any swelling there. That's wonderful. All right, go ahead and push against my hands, and pull. Push up on my hands, and push down. Great. I'm going to check your pulses. All right. Great pulses, and cap refill is less than 3 seconds. So skin is normal, dry, intact. That all looks great. Okay. Looks like everything's good to go, sir.
Thank you.
I'll let your doctor know about my findings. And thank you so much for coming here today.
Thank you.
You're welcome.
Have a great day.
Thanks. You too.